Have you ever wondered why healthcare costs in the United States dwarf those in most European nations, yet outcomes aren't always superior? This isn't just a casual observation, it's a complex debate with profound implications for public health, economic stability, and individual well-being. In this comprehensive analysis, we'll dissect the fundamental structures, philosophies, and outcomes of the U.S. and European healthcare models, aiming to provide a balanced, evidence-based perspective on which system truly delivers better care. The United States healthcare system stands as a global anomaly, primarily driven by a complex web of private insurance, market forces, and a fragmented delivery model. Unlike most developed nations, there is no single unified national health system guaranteeing universal coverage. This unique structure shapes everything from patient access to the cost of a simple prescription. At its core, the U.S. model relies heavily on private health insurance, predominantly employer-sponsored plans. Millions of Americans receive coverage through their jobs, with employers often subsidizing a significant portion of premiums. However, even with employer coverage, patients typically face substantial out-of-pocket costs through deductibles, copays, and coinsurance, which can quickly accumulate, especially for chronic conditions or unexpected emergencies. For those not covered by employer plans, the individual market, often facilitated by the Affordable Care Act, ACA, marketplaces, offers options, though premiums can be high and subsidies vary. This market-driven approach means that healthcare services are often treated as commodities, subject to supply and demand rather than a fundamental right. The result is a system where financial capacity often dictates access to timely and comprehensive care. The financial burden extends beyond premiums and copays. The U.S. healthcare system is notorious for its lack of price transparency, leading to surprise billing, where patients receive unexpected charges from out-of-network providers involved in their care, even at in-network facilities. This financial uncertainty is a major source of stress and medical debt, contributing significantly to personal bankruptcies. While public programs like Medicare, for seniors and some disabled individuals, and Medicaid, for low-income individuals and families, provide crucial safety nets, they cover specific populations and operate under different rules. These programs, while vital, do not fundamentally alter the private sector dominance that defines the broader U.S. healthcare landscape. The sheer scale of administrative overhead, driven by multiple payers and complex billing procedures, further inflates costs, consuming a substantial portion of the nearly 20% of GDP dedicated to healthcare. In stark contrast, European healthcare systems generally prioritize universal access and social solidarity, with governments playing a central role in funding and regulating care. While there's no single European model, most nations operate under principles that ensure healthcare is a right, not a privilege, largely decoupling access from an individual's ability to pay. This fundamental philosophical difference leads to vastly different structures and outcomes. Many European countries employ a Bismarckian model, like Germany and France, where healthcare is funded through mandatory contributions from employers and employees into sickness funds. These funds are quasi-public, non-profit entities that cover a comprehensive range of services. While patients often have choice among providers, prices are typically negotiated nationally, and out-of-pocket costs are significantly lower than in the U.S. This system emphasizes social insurance, where contributions are pooled to cover everyone. Alternatively, countries like the United Kingdom and the Nordic nations often utilize a beverage model characterized by a National Health Service, NHS, funded primarily through general taxation. In these systems, healthcare providers are often government employees, and services are largely free at the point of use. This model aims for maximum equity, ensuring that everyone, regardless of income or employment status, has access to necessary medical care. Across Europe, cost control is a central feature. Governments or national bodies often negotiate drug prices, set global budgets for hospitals, and regulate physician fees. Primary care physicians, GPs, often act as gatekeepers, managing routine care and referring patients to specialists when necessary, which helps manage demand and optimize resource allocation. This integrated approach, coupled with a strong emphasis on public health and preventive care, contributes to lower per capita spending and often better population health outcomes compared to the U.S. Despite its cost challenges and equity issues, the U.S. healthcare system possesses undeniable strengths, particularly in the realm of medical innovation and access to cutting-edge treatments. For those with comprehensive insurance and financial resources, the American system can offer unparalleled access to advanced medical technology and specialized care. This is a critical point for researchers and policymakers to consider when evaluating system performance. The United States is a global leader in biomedical research and development, with significant investment from both public, for example, National Institutes of Health, and private sectors, pharmaceutical and medical device companies. This robust R&D ecosystem often translates into faster development and adoption of new drugs, therapies, and diagnostic tools. Patients in the U.S. frequently have earlier access to novel treatments for complex diseases, such as advanced cancer therapies or gene editing technologies, sometimes years before they become widely available in other countries. Furthermore, American hospitals, particularly academic medical centers, are renowned for their highly specialized services and state-of-the-art facilities. For rare diseases or complex surgical procedures, the U.S. often boasts a concentration of world-class experts and advanced equipment. Patients with excellent insurance can often secure appointments with top specialists and undergo elective procedures with relatively short wait times, a distinct advantage over systems where waitlists for non-emergency care can be lengthy. The competitive nature of the U.S. market, while contributing to high costs, also fosters a drive for technological advancement and service excellence among providers. This can lead to a wider array of choices for patients, assuming they have the financial means to access them. For individuals seeking the absolute latest in medical science and specialized care, the U.S. system, under ideal circumstances, can be exceptionally responsive and effective. Europe's healthcare systems shine brightly in areas where the U.S. often falters: universal accessibility, financial protection, and a strong emphasis on public health. These strengths are particularly relevant for the general public and policymakers concerned with societal well-being and equitable access to essential services. The core principle is that no one should face financial ruin or be denied necessary care due to their economic status. A cornerstone of European healthcare is the guarantee of universal access. Whether through tax-funded systems or mandatory social insurance, virtually all citizens and legal residents are covered for a comprehensive range of medical services. This eliminates the fear of medical bankruptcy, a pervasive concern in the U.S., and ensures that individuals seek care when they need it, rather than delaying treatment due to cost concerns. This proactive approach to care, particularly for chronic conditions, often leads to better long-term health outcomes. The focus on primary care is another significant strength. General practitioners, GPAs, serve as the first point of contact for most health issues, providing continuous, coordinated care and acting as gatekeepers to specialist services. This model promotes continuity of care, builds trust between patients and providers, and efficiently manages healthcare resources. It also emphasizes preventive care, including vaccinations, screenings, and health education, which are crucial for maintaining population health and reducing the incidence of preventable diseases. Moreover, European systems generally achieve better health equity. By removing financial barriers, they reduce disparities in access and outcomes based on socioeconomic status, race, or geographic location. This commitment to social solidarity means that the healthy contribute to the care of the sick, and the wealthy support the care of the less fortunate, fostering a more cohesive and resilient society. The result is often lower infant mortality rates, higher life expectancies, and better management of chronic diseases across the population compared to the U.S. No healthcare system is without its flaws, and both the U.S. and European models present distinct challenges and trade-offs. Understanding these weaknesses is crucial for a nuanced debate and for informing potential reforms. For students and researchers, this comparative analysis highlights the complex interplay between policy choices and real-world consequences. The primary weakness of the U.S. system lies in its profound issues of affordability and inequality. Despite spending significantly more per capita than any other developed nation, millions of Americans remain uninsured or underinsured, leading to delayed care, poorer health outcomes, and staggering medical debt. Health disparities are stark, with racial and ethnic minorities, low-income populations, and rural communities often experiencing significantly worse access to care and health outcomes. The market-driven approach, while fostering innovation, often fails to deliver equitable access to basic care, creating a two-tiered system where quality of care is heavily dependent on one's insurance status and financial resources. Conversely, European systems, while excelling in accessibility and equity, sometimes face challenges related to efficiency and patient choice. A common criticism is longer wait times for non-emergency procedures, such as hip replacements or cataract surgeries. While emergency care is typically swift, elective procedures can involve significant delays, which can impact quality of life for patients. This is often a consequence of budget constraints, workforce shortages, or the centralized planning inherent in many public systems. Furthermore, some European systems may offer less patient choice in terms of specific providers or facilities, especially in highly centralized models. While primary care is robust, access to the latest medical innovations might be slower than in the U.S., as national health authorities often conduct rigorous cost-effectiveness analyses before adopting new, expensive drugs or technologies. This cautious approach, while fiscally responsible, can sometimes mean patients wait longer for cutting-edge treatments. Both systems grapple with the rising costs of an aging population and the increasing prevalence of chronic diseases, but their approaches to managing these pressures differ significantly, leading to distinct sets of advantages and disadvantages. So, after this extensive comparison, which system is better? The answer, as with many complex societal issues, is not a simple one. It fundamentally depends on what values and priorities one places at the forefront of healthcare provision. This is the core of the debate for policymakers and the general public alike. If your primary value is rapid access to the absolute latest medical innovations, specialized treatments, and a wide array of choices, assuming you have the financial means, then the U.S. system, for its top-tier beneficiaries, might appear superior. It is a system that rewards innovation and offers unparalleled options for those who can afford them. However, this comes at the steep cost of widespread inequality, financial insecurity for many, and a fragmented approach to public health. If, however, your priority is universal access, financial protection, health equity, and a strong emphasis on preventive and primary care for the entire population, then the European models generally offer a more compelling solution. These systems ensure that illness does not lead to bankruptcy, and that everyone, regardless of their income or social status, has a right to essential medical services. While they may sometimes involve longer wait times for elective procedures or slower adoption of certain new technologies, they deliver better overall population health outcomes and greater social solidarity. The debate is not merely academic. It reflects deeply held societal beliefs about the role of government, individual responsibility, and the nature of healthcare itself. Both systems offer valuable lessons. The U.S. could learn from Europe's commitment to universal access and cost control, while European systems might explore ways to accelerate innovation and reduce wait times without compromising equity. Ultimately, the better system is the one that best aligns with a society's collective values and effectively addresses the health needs of all its citizens. The comparison between the U.S. and European healthcare systems is a dynamic and ongoing discussion, impacting millions of lives globally. We've explored the intricate structures, the philosophical underpinnings, and the tangible outcomes of these divergent approaches. Now, we invite you to contribute to this vital conversation. What are your thoughts on the trade-offs between innovation and accessibility? Do you believe healthcare is a fundamental right or a service to be purchased? Share your insights, experiences, and perspectives in the comments below. Your voice is crucial in shaping the future of healthcare policy and understanding the diverse needs of our global community. Don't forget to subscribe for more in-depth analyses and discussions on critical topics in health, economics, and society.